It's another day with the physicians where your health is our business. It grows towards the end, so you are not going to take some drastic measures. But a 10-year-old coming, pressure is high, but also to know that it's not only when your pressure is high that you have glaucoma.
And I don't know about any other one, but what do you know?
You're welcome back to the training also of your regular program.
Mastectomy simply means surgical removal of the breast, most of the time due to breast cancer.
Gastroesophageal reflux disease is a digestive disorder that occurs when acidic stomach juices or food and fluids, the stomach content actually, flows back up from the stomach into the tube connecting the mouth and stomach, that is the esophagus. This backwash, that is the acid reflux, can irritate the lining of the esophagus. Reflux becomes a disease when it causes frequent or severe symptoms or injury. Reflux may damage the esophagus, the pharynx, or respiratory tract. Gastroesophageal reflux disease affects people of all ages, from infants to older adults. People with asthma are at higher risk of developing this disease. The main symptom of this disease is heartburn, often described as a fiery feeling in one's chest, and regurgitating sour or bitter liquid to the throat or mouth. The combination of heartburn and regurgitation is such a common characteristic of gastroesophageal reflux disease that formal testing may be unnecessary. On your regular TV health talk show, The Physicians, we shall be discussing gastroesophageal reflux disease. Stay tuned. There with the physicians where your health is our business. My name is Dr. Martina Agbere, your regular host on this program. We'll be discussing gastroesophageal reflux disease, popularly known as acid reflux. With me in the studio, I have a guest. She is a consultant gastroenterologist and, of course, a hepatology. She is also a member of the Society of Gastroenterology and Hepatology in Nigeria, and works with the General Hospital, IFAKO-IJAIYE, here in Lagos. She is no other person than our wonderful guest, Dr. Duro Emmanuel. Doctor, you're welcome to our program.
Thank you.
So let's just go straight to the program, to this topic, because we have a lot to talk about it.
Yes.
Talking about gastroesophageal reflux disease,
Yes.
also known as acid reflux.
Yes.
So maybe we'll just give our viewers out there, because I know they are always anxious, wanting to hear very, very important points on our program, The Physicians. So we're talking about gastroesophageal reflux disease, acid reflux. Give us a general overview before we talk about the symptoms.
Okay. Generally, Gerd, reflux, is a common thing. It's common to everyone. It now becomes a problem when you're having it more frequently and you have symptoms that are quite severe. I'm sure everyone has experienced overeating and then food coming back up to your mouth. That is regurgitation. It's not vomiting. And you've had one time or the other, you've had this burning sensation in your chest. But when it becomes too frequent and quite severe, then we think of it as reflux disease. Now, what is reflux disease? Reflux disease just means that the contents of your stomach goes back up to your throat. Now, we all know when we eat, it goes down. It's down by gravity. Nothing going down should come back up.
Absolutely.
All right. So it goes down to the stomach. So what makes it go back up? In some cases, it could be because the supporting structures of supporting our diaphragm. Now, our throat passes through the diaphragm. It's a long muscular tube that enters from our mouth all the way down into the stomach. So, but between that, you have the diaphragm, which acts as a supporting structure for the things up here, your lungs, your heart, and all that, between your thorax, your chest area, and your stomach area. So it could be that your diaphragm, that is keeping the structures of the throat, is a bit lax. It could be that even within the throat, there are gates. We call them sphincters. So those sphincters may be lax, may be much more relaxed than normal. So that pressure to keep it closed when it is not working is just left open all the time. So of course, if you overeat or your stomach is overstretched, the contents will go back up. So in cases of obesity, somebody is really, really fat, everything is stretched out. In cases of pregnancy, where the uterus pushes the stomach up, as the baby is growing, you can have reflux disease. In cases of overeating, as I said, you can have reflux. So reflux is very, very common. It is common, but as I said, once it becomes more frequent and more severe, then there is a problem.
Okay. So the symptoms, is it just the acidic taste that one has in the mouth?
Now, in the stomach, we have different types of juices, not just acid. We have alkaline. These are things that will just break down the food that you eat. Now, the commonest ones are, the commonest on the acid types is what we call hydrochloric acid and pepsin. These are all things that work to break down the food. Now, when the food is being broken down in the stomach, it's mixed with the acid. So is that when it now backlashes back to the throat for whatever reason, then it causes irritation of the throat, of the lining of the throat. And over time, even that lining changes the way it's supposed to look, because the lining of the throat is supposed to do what? Allow passage of food to go down. So after a while, you see that the lining of the stomach is encroaching on the lining of the throat. So that will cause other symptoms. It may even cause food not passing down well. You will have, that's where you have problem swallowing or even pain on swallowing.
Some people complain of chest pain?
Yes, the chest pain is more from that sensation of heartburn that we call it, that behind your chest, that feeling of peppering sensation that you have, yes.
Okay, for pregnant women, that one is understandable?
Yes, it
because
is.
Of the
and once they deliver, in most cases, it will resolve.
Okay. So, are there predisposing factors apart from the obesity that you talked about? For instance, for patients that probably will take some fried foods, spicy food, they complain that they also have reflux.
Well, I will go more with those who take medications that may also further irritate not only the throat but the stomach as well. We call them non-steroidal anti-inflammatory drugs, especially elderly people. Let's say because they have joint pains, rheumatic pains, so they tend to use this kind of drugs. Example, diclofenac, Felvin, ibuprofen. So those kind of drugs, aspirin. Even those who are hypertensive, diabetic, they are placed on aspirin to protect the heart. And then you find out that such things cause problems in the stomach and the throat. Okay. So it can predispose them to having reflux.
Okay. Is there a link between this reflux and patients that have ulcer?
No, in the sense that it may seem similar in the way they present, but the way it is, it's more of a functional problem with reflux. Reflux is the stomach contents going to the throat based on the fact that supporting structures are weak or the sphincters are weak, all right? So there is a supporting structure problem, all right? Unlike ulcer, ulcer means a wound on the lining of the mucosa, the lining of the GIT, from the throat all the way to the stomach. So it's a wound that has been caused either by the use of these NSAIDs or by alcohol, or even by the most common one, the bacteria, Helicobacter pylori. Okay. So they are different. Okay. It's just that the presentation may seem the same.
Okay, for instance, you talked about the reason why one is likely to have a reflux.
Yes.
Okay? Whatever it is that will make the food that you have taken in to come up.
Yes.
Is it possible that there's an obstruction along the alimentary canal that can actually cause the food not to go down properly and have reflux? For instance, like a tumor along that esophagus?
Well,
or a lump
that
or
will not cause essentially reflux. They will come with what you call difficulty swallowing. When it comes to reflux, it's two main symptoms. Regurgitation, the contents coming back up into your mouth, and that heartburn, all right? That is what we refer to as reflux. Now, when you start having difficulty swallowing or pain on swallowing, complication has started, okay. All right? So that in itself is not reflux. Okay.
Do you do any special investigation to confirm that the person has a reflux?
Yes, there are tests, but we look at what age or how you're presenting. If it is somebody less than 40 and is presenting with these symptoms, we will say, okay, this is Gerd. You don't need so much intensive investigation, all right, unless the person is coming with complications or coming with things that are not original. Remember I said regurgitation and heartburn. Yeah. In some cases, you can have what we call extraesophageal symptoms. That means things that you don't even think may be related to reflux. I'll give you a very good example. Dental caries, dental tooth decay. Mm-hmm. Because when you lie down and you reflux at night, that food aspirates, that food can gradually dissolve the enamel of your tooth. So you can have, so you wake up in the morning. So people wake up in the morning with a bitter taste in their mouth. Yeah. And of course, usually people with bitter taste, they'll say, oh, I have malaria. But it's not, So they could wake up with bitter taste in their mouth. So that is one. They could wake up with bad mouth odor, halitosis. That is one. You could wake up with, or they could at night start coughing. So night cough, and some people would think that is asthma because of irritation of your voice box, because of all these places in the throat. They are all connected.
Wow. When we come back, we will talk about more about the management. How can it be managed? Yes. We need to keep a date with our physicians out there. Right. So I'm sure you've been following what Dr. Duro Emmanuel has been talking about, gastroesophageal reflux, also known as acid reflux. Let us hear from you what you have to tell us about it. Reflux, acid reflux. Are there been times when you just lie down and you feel this sudden thing in your mouth, like being acidic? Even when you lie down at times, it just also comes. Have you experienced it before? Let's hear from you out there. We'll be back after this short break.
Yes, I've experienced it.
Yes, I have actually experienced that.
Of course, I've experienced it, but it's not direct to me.
For me, I think for fluids or food to flow back to your mouth, I think is indigestion.
It can be when you don't have the ability to digest food, or when you rush the food, or you can't tolerate the food you ate.
Indigestion, or if the food is not that pepperish, can make the food back to the mouth.
But before I experience it, I will ensure people to drink enough water. And when it happens, you still have to drink water or see your doctor. He can recommend some drugs for you.
For some people do take water. Some people do take something pepperish. While some people do take alcohol to quench that thing down.
Whenever such happens to me, I think I take suspension drugs, or better still, I go for the popular liver salt to suppress it.
If you have just joined us, you're on your regular program, The Physicians, where your health is our business. We've been talking about gastroesophageal reflux disease, also known as Gerd. And Dr. Duro Emmanuel has been doing justice to this particular topic. She told us the reasons why people actually will experience this. Obesity as a risk factor also. And most times, we also have what we call the sphincters. We call them the gates, the gateway. So when you take food in, it goes through the mouth, to the esophagus, to the stomach. But we have something that we call the sphincters that usually would help. So if those sphincters are actually weak as a result of maybe a disease condition or as a result of obesity, then you can actually have what we call the reflux. Now we want to ask her, let's hear what she has to tell us about the management. When you have patients that have this kind of health challenge, what kind of management options do they have?
Okay. Well, we'll look at the non-pharmacological, that is not without the use of drugs. The first thing is lifestyle modification. What is it about that patient that is predisposing that patient to have reflux? So if the patient is on the fat side, is on the obese side, that is after checking the body mass index and saying, oh, you're a bit either overweight or obese, then you should ask, that person should reduce the weight. That would help a lot. And then we talk about the eating, don't eat too late at night. You know, you could set a time where you could say, oh, from 7 or 8, because when you eat, you have to give time for digestion, and digestion takes about 3 to 4 hours. So you can imagine most of the time when we eat, in the next few minutes, you're feeling sleepy, and the thing is you want to go and lie down and sleep. And by lying down to sleep, that is causing reflux. So we say, okay, when you eat, try not to eat too late at night. Try not to eat heavy meals at night because it takes a longer time to digest. And then sit for a while. Don't just lie down. Don't just go straight to lie down. Yeah. Okay, those are the little things that could help. And then in some cases we say, okay, get some blocks, some wooden blocks, and put at the edge of the bed.
Okay, to prop it up.
You know,
even so maybe you have a pillow?
Yeah, pillows won't work. Oh. Because when you lie down, you know, you're restless. And then you can slide down from no matter how high the pillow is. After a while, you slide down. So it is gravity, remember? So gravity will ensure that the food remains down. So if you lift up with a 4 to 6 inch block at both ends of your bed, it will give that natural incline, which will help. And then there are some certain foods that can lower this pressure in those gates that we talked about. Remember, when you eat and the food goes down, the sphincters will open so that the food could enter the stomach and then it will close. All right? But certain foods, things like chocolates, things like mints, things like tomatoes, you know, these things, they help to cause more further relaxation. So we say avoid them. Because the thing that happens that most people, when they first start feeling that burning sensation, they will say it's pepper. And then instead they will say, we'll stop eating pepper, I'll start eating tomato, which makes it worse. So we're like, no, don't do that. And then over-the-counter medications like antacids, these are supposed to antacids, anti-acids. So it's supposed to counter the effects of the acid, you know. And there are some that also, they're called alginates. They're supposed to cause like a raft. Okay, so when you eat, it forms like a foam. When you take it, it forms like a foam on top, so that that acid will not be able to go or come up. You know, so those are just the first measures. Then, of course, those that have it really severe, we can place them on medications, and those medications will help the acid so that to give time for the lining to heal.
Okay. So, at what point should an individual who has this reflux, acid reflux, see a doctor? At what point do you think is an emergency to need to see a doctor?
Well, I won't say emergency. When you notice that this is becoming too frequent for you, or when you notice complications are setting, all of a sudden, before you could eat, and all of a sudden you're finding it difficult to swallow, or you're finding you're having pain on swallowing, or you start losing weight, you know, then something is going on. So that should be checked out, you know.
There's something that is going on. We're having people trying to lose weight and they now use this balloon, implant. Do you think that they will also come down with reflux often?
Now, it's not really the balloon that they put there for, you know, those that do gastric bypass. It's actually the waist trainer that they put on, you know, because especially those, you know, now there are so many BBLs going on, and they have a lot of girdles, these waist trainers. Another thing is to avoid wearing tight clothing, so that diaphragm is left to do the support. But in this case, it's pushing up. It's pushing up the stomach, and then of course, where will it go? It will go out. You know. So it's cases like that we'll say, okay, don't wear tight clothing. You know.
Well, it's really nice again having you on our program.
Thank you.
And I'm sure our viewers out there benefited a whole lot from what you have said. Take home is, first and foremost, try, if you're on the obese side, try as much as possible to lose weight. Then don't eat food that is heavy at night. Even if you eat, try as much as possible to sit down upright for a while, because it takes like 3 hours for food to 3 to 4 hours for food to digest. So imagine you taking food at 8 o'clock, 9, 10, by 11, 12, digestion is just about ending. So thank you very much, Dr. Duro Emmanuel, and I'm sure we'll call again. You'll answer our call. And to our viewers out there, it's always a pleasure knowing that you're always there, waiting anxiously and listening to us on The Physicians. I hope you did take a lot home today. And we're heading from what she said, for those that are obese, acid reflux is bound to happen. Try as much as possible to shed some weight. I'll always say it, and I will keep saying it. If we put the benefits of exercising as a pill, it will be the best sold pill in the world. Then again, mind what you take. Those of us that like to take chocolates at night, I just feel really nice, I just want to take chocolate or take mint. You have heard it also. These are some of the things that will actually encourage and are risk factors for you to have reflux. The one takeaway thing is that she said, if you can actually prop your bed up with stones at the so that the upper part is a bit elevated, it will help with the gravity. So on that note, I say thank you so much again for keeping a date with us, your physicians, where your health is always our business. Remember to follow us on our social media handle, on Instagram, on YouTube, and on Facebook. And if you want to be part of this program, just go to our website, which is now functional, and send us an email. My name is Dr. Martina IJAIYE. Stay blessed.
I'm Dr. Lera Roberts. I'm the second Vice Chairman of the Association of Public Health Physicians of Nigeria, Lagos branch. Please do not play with your life. It is so imperative that you do the right thing. You must keep watching the physicians for more information.